Yes, good morning, ladies and gentlemen. Today we are going to continue with health promotion. Last time we introduced health promotion, we looked at the math of health promotion, which was the Ottawa Charter, and we looked at what strategies they proposed and the key principles of health promotion. Then we also introduced a bit of theories and models where we talked about the health belief model, which really focuses on the perceived susceptibility of an individual to a certain health, health outcome, and then the benefits of taking up a particular behavior in health and the, the consequences of that. So today we want to explore more about the theories and models that influence our practice in health promotion. So let's look at theory of planned behavior. So in theory of planned behavior, uh, the the social psychological model proposes that an individual's attitudes, subjective norms, and perceived behavior control influence their intention to engage in a particular behavior, which then influences their actual behavior. So in this, we recognize that intention is one of the most influential things when we talk about behavior, but this intention to perform a behavior is affected by those three aspects: the attitudes, the subjective norms, and the perceived behavior control. And when these come into play, they all affect behavior. So the building blocks of this theory, of the theory of planned behavior, like you've seen in the pictorial representation, include the attitude towards the behavior. So we should think about the attitude towards the the consequences of performing that behavior or the benefits that could result from this behavior. So does an individual have a positive or negative attitude towards that? So for example, if you're promoting cessation or stopping of smoking, so you should be able to assess whether the attitude towards that stopping of smoking in that individual is going to be positive or negative. What they should be able to have a positive attitude towards the life after they have stopped that smoking. Then subjective norms refer to the perceived social pressure to perform or not to perform the behavior based on the beliefs of the significant others. This could be family, friends, or peers. So you have to look at what the people around these people that you want to promote health in, what they think of them, because it is more likely that if the significant others, maybe a relative or a friend, if they think that that behavior that you're promoting is good for them, then they will be able to take up the same behavior. So if you want someone to maybe uh, go for cancer screening and their relative thinks otherwise, or a relative whom they believe so much in thinks otherwise, then it might be hard for that person to go on and take up the behavior that you want them to do. So you have to think about all those when you're promoting health. And then the third construct is perceived behavior control, which is more of self efficacy, that belief in one's ability to perform the behavior, taking into account the factors that might facilitate or impede the behavior. So, in this case, we want to look at how you can increase someone's ability by either providing them information, by counseling them, and also providing the necessary resources that can increase their confidence that they are going to perform or maintain this behavior. Then, in this behavior of theory of planned behavior, we have theory of reasoned action, which proposes that an individual's behavior intentions directly determine the behavior that they are going to perform. So an individual's intentions to perform a behavior increase and they are more likely to actually perform it. So like I said, one of the most important things in behavior performance is that an individual should have that intention, and these intentions are always influenced by what we said earlier, what other people think about the same behavior, that is the subjective norms, the perceived behavior control, or someone's belief that they can perform the behavior, and then the attitude towards the behavior, is it positive or negative, especially the consequences of that behavior. So advantages of this theory of planned behavior is that it is a useful tool in predicting and understanding health behaviors, and it has been applied in various behaviors such as physical activity, health, healthy eating, and condom use. So all these are desirable behaviors in health promotion. So once someone changes from being physically inactive to being physically active, then you can confidently say that they have a better healthy behavior. Then healthy eating to prevent issues like obesity and the diseases that come along it, and then condom use to prevent cause unwanted pregnancies and STDs. So, of course, like any other theory, it has criticisms, and one of the major criticisms is that this theory of planned behavior does not account for social and environmental factors that may influence behavior, and yet they are very, very, very essential in determining which behavior an individual will take on. And then the fact that emotions and other non-rational factors are also not considered is also another criticism of this theory. Then the other theory that we had introduced last time, but we didn't go further to talk about it, is the social cognitive theory, and this was put forward by one of the greatest psychologists called Albert Bandura, and he proposed that behavior change occurs through reciprocal interaction between an individual's factors, environmental factors, and behavior. So to him and the people that he worked with, behavior does not just occur, and it is not a standalone concept, but it is more of an interaction between individual factors and environmental factors and behavior itself. So all these influence each other in that reciprocal uh, manner, and then you end up having the outcome as behavior. So it emphasizes the importance of self-efficacy, or the belief in oneself to perform a behavior, observational learning, which really focuses on the fact that people learn from the people who are around them, especially when the consequences of those behaviors are good, and then reinforcement in behavior change, which focuses on rewards for desirable behavior. So the constructs or the building blocks for this social cognitive theory by Albert Bandura that focuses on reciprocal interaction between individual factors, environmental factors, and behavior include: one, self-efficacy, that is an individual's belief in their ability to perform a specific behavior successfully. So as expected, high self-efficacy, or that high belief in oneself to perform a behavior, will increase the likelihood of engaging in health behavior. Then number two of in the constructs includes observational learning. which is the process of acquiring new behaviors by observing and imitating others, particularly role models. So when we are implementing those health promotion programs, we should be able to make sure that we put in place those role models who have desirable behaviors. Yeah, these people should be surrounded by the people that they look up to who have desirable behaviors. So, for example, if you're going to promote hand washing in a community which which values opinion leaders or their political leaders, and they are more likely to perform the behaviors that their political leaders are also performing, you need to make sure that these people or the political leaders have those hand washing facilities in their homes so that whenever they can go to visit these people and they engage in this hand washing, they are also able to do that hand washing or take up that hand washing facility in their homes, because and there you'll be using this construct of social cognitive theory called observational learning. Then the other construct of this SCT or the social cognitive theory is outcome expectations. And here we are looking at the anticipated consequences or effects of that behavior. So positive outcome expectations can motivate individuals to adopt healthy behaviors, while negative expectations may deter them from doing so. So you imagine if you're promoting cessation of or stopping of smoking. So you need to make sure that these people appreciate the outcomes of such a behavior of stopping. If you stop smoking, you will be at less risk of developing lung cancer. So if they see that as a positive outcome, then they will be motivated to adopt that stopping of smoking. But if they realize that there isn't any positive outcome, then it means that they might continue with smoking. Also, the negative expectation that they might gain that lung cancer will deter them from uh, from smoking itself. Then the other construct is reciprocal determinism, which is the interaction between individuals, their behavior, and the environment. And this construct emphasizes the mutual influence of these factors on one another. So it means that the individual's behavior determines the environment, and then the environment also does the same to the behavior. So you can imagine if someone is in an environment that is full of smokers, it is more likely that this environment is going to influence the person to take up smoking. Okay, so if you're going to roll out your program of health promotion and it is focusing on this smoking, you make sure that this environment is favorable to stop that smoking. Do not focus on this individual alone, focus on the entire environment, the people around him, so that they can also stop smoking, and inevitably this person will also desist from that smoking. And also the individual himself influences the environment, and this is what we are calling reciprocal determinism. If they are smoking, then that means that it is more likely for the people around them to also engage in the same. So the advantages of this social cognitive theory is that it is a useful tool in determining and predicting behavior change, and it has been applied in various behavior change programs like to promote physical activity, healthy eating, and smoking cessation. The criticisms to this theory is that also it does not account so much of the environmental factors that influence behavior, and also doesn't account for emotions and other non-rational factors that may influence behavior. So in this case, the fact that this theory does not take into account the fact that a person can make a decision out of emotions is a very big criticism to it. But nonetheless, it has been applied in various health behaviors, like I said, including in promotion of physical activity, healthy eating, and then condom use. Then the third theory that we need to look at is the trans model, which has also been termed as the stages of change model. And in this case, it proposes that behavior change does not occur in just uh, one step or just haphazardly, but it occurs in stages which include pre-contemplation, contemplation, preparation, action, and maintenance. And this emphasizes the importance of self-efficacy or the belief in oneself to perform a behavior. So these stages, if we are to look at them in depth, stage number one being pre-contemplation, here the individual or a community has no intention of changing their behavior and they are unaware of the problem or in denial. So if you're approaching someone who is physically inactive and then you want to make them engage in physical activity, they do not see any problem with their physical inactivity. And in that stage which they are in uh, is what we call pre-contemplation. And then stage number two could be what we call contemplation, when they realize that there is a problem, but they are not yet ready to commit to changing. And then stage number three after contemplation is preparation. That means that they have intention to change and to take action. They have there is a little small changes and they have set goals and priorities but have not yet taken action. So you imagine this stage in such a person who has been physically inactive. They have now set goals of maybe uh, engaging in physical activity like 3 times in a week, and they have stopped taking some foods, but there isn't much action that can be that can be seen as as behavior change. So in stage number five is what we are calling action, or the commitment to change behavior and dedicating considerable time and energy, making changes and developing strategies to overcome the barriers. So in this case, with our example of physical inactivity, the person has now started taking action. They are devoting their time to that physical activity. They are taking part in physical activity drills and maybe devoting like 3 days in a week to perform those physical exercises, and also putting in place strategies to overcome barriers. Yeah, for example, if there are friends who are discouraging them from taking up such physical exercises, then they can tend to avoid them or also encourage them to take up the same. So during that stage, we consider them to be in an action phase. Then number six of this trans theory model or stages of action model, stages of change model, is what we call maintenance. And in this case, the person is already taking action, and more to that, they work to prevent the relapse and adapt to change. So they do not want to return to their old selves. In the case of the person who has been physically inactive and now they are already doing those physical activities and have already devoted their time to and energy to do the same, you expect them to work in a way that prevents relapse. They make sure that they do not return to their old self of being physically inactive. and they put in strategies of making sure that they do not return to that phase by joining groups of people who do the same physical exercises, by setting reminders, by eating in a healthy way, by avoiding those activities which promote their physical inactivity. And then the last phase, which is not always achieved, is termination, where the behavior, where the person has reached all 100% self-efficacy and they cannot return to their old self. But in most cases, this stage is not always achieved, and people remain in the maintenance phase, where they just prevent relapsing or going back to their old self. So the constructs of this trans theory model is the fact that number one, stages of change, whereby we acknowledge that the process of behavior change occurs in a series of stages, which include that pre-contemplation, contemplation, preparation, action, maintenance, and termination. Then construct number two is decisional balance, where an individual weighs the benefits and the barriers of adopting a specific behavior. So before they engage in this particular behavior, which is desirable as far as as uh, as living in a healthy manner is concerned, they must weigh the benefits, which we have termed as pros, and the barriers, or the or the risks that could arise from this behavior. So this trans theory model proposes that change of behavior to a desirable one does not just occur, but it involves the individual in the community that is going to take up that behavior, weighing the benefits and then the barriers, then seeing if the benefits can outweigh the barriers, and then they can take up the behavior. Then construct number three is self-efficacy, which focuses on the belief of one's self to perform a specific behavior successfully and overcome the barriers. Then number four is the fact that we have processes of change, which include the cognitive, the emotional, and behavior strategies that the people use to progress through the stages of change. So the advantages of this trans theory model or stages of change model is that it is a useful tool in understanding and predicting behavior change, and has been applied in various behaviors such as smoking cessation, uh, limiting alcohol use, and promoting physical activity. The criticism again is that it lacks specificity because of involving all those stages, and precision, and its focus on individual behavior rather than the social and environmental factors has also been criticized. But uh, doesn't take away the fact that it has been applied in various health behaviors such as smoking cessation, uh, limiting alcohol use, and promoting physical activity. Now, the fourth theory that we are looking at today is the diffusion of innovations theory, which has been uh, abbreviated as DOI, and it proposes that adopting an innovation such as a health behavior, because a health behavior which has not been uptaken or undertaken by a person or a community is going to be an innovation. We look at it as an innovation, so that is why we apply this diffusion of innovation theory. It is a new thing to them, and according to this theory, it occurs through through series of stages, including knowledge, uh, knowledge of that behavior, or understanding all about this behavior. Persuasion, this is convincing the person that this behavior is going to be good. Decision, which involves the person making a decision to take up this behavior. And then implementation, meaning that they have now taken action to take up this behavior. And then confirmation, which means that they are going to fully take up this behavior and maintain it, because they have appreciated from knowledge and persuasion that it is the best for them to live healthily. So it emphasizes the importance of communication channels, social networks, and opinion leaders in adopting new behaviors. So this DOI, or the diffusion of innovations theory, is a useful tool in understanding and predicting the adoption of new health behaviors and interventions that, that have been applied to various behaviors such as immunizations, cancer screenings, and HIV testing. So, in immunizations, especially of new vaccines, you have to use this diffusion of innovation theory so that people can appreciate the importance of taking up that new vaccine. But it has been criticized because it doesn't account for the complex and dynamic nature of social networks, and doesn't also account for the context in which innovations are adopted. So it is a theory that has been also criticized because it doesn't account for individual variation in the adoption of those innovations, because not all individuals will adopt an innovation or a health behavior in the same way. So the fact that the fact that this theory does not put into does not take into account of those individual variations in adoption of innovations or those health behaviors is a big criticism that has been directed to it. Nonetheless, this diffusion of innovation theory has been applied to various health behaviors such as immunizations, like I had said, cancer screening, and HIV testing. Second last theory that we are going to look at is a model called social ecological model, which proposes that behavior is influenced by multiple levels of influence, including individual factors, interpersonal factors, organizational factors, community factors, and policy factors. So, as you can imagine, this is one of the most holistic and comprehensive models that we can always use in our implementation of health promotion programs, because it emphasizes the importance of understanding the broader social and environmental context in which behavior occurs. So the constructs or the building blocks of this social ecological model include individual factors, which focus on the personal characteristics that influence health behavior, such as one's age, one's gender, their knowledge and cognition, their beliefs and attitudes. And then it also has a construct of interpersonal factors, which include the social networks and relationships influencing the healthy behaviors, such as family, friends, peers, and co-workers. So this model really focuses on each and everything that can affect one's uptake of a health behavior. And at interpersonal level, you look at whether the family around you will encourage you or discourage you from taking up a health behavior, whether the friends, the co-workers who are around you will also encourage you or discourage you from taking up a particular health behavior. At community level or the community factors, we look at the organizations, the institutions and systems that impact health behaviors, such as schools, workplaces. Are there regulations to stop maybe smoking in a public place? At school level, are they providing you with the necessary information that you need to increase your self-efficacy or your ability to the belief in yourself to take up a healthy behavior? So all these factors, according to this social ecological model, influence behavior. Then it goes on to focus also on societal factors, the broader cultural, economic, and political factors influencing health behavior, such as the social norms, the laws, the, the values and regulations at society level. There are those norms, there are those values that exist, the regulations, and these all come together to influence whether a person or a community takes up and maintains a health behavior. Okay, so all these are constructs of socio-ecological model, which makes it a more holistic and, 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 and comprehensive model to always use in our health promotion activities. Then it does not stop there, but also looks at the environmental factors, which are the physical and built environment factors that can influence health behavior, such as access to green spaces, walkability, availability of health food options, because you might be taking your health promotion activity to increase physical activity in these people who are obese, but are you sure that these people have access to to places where they can do their do the exercises in? Okay, do they have can they access healthy food options? So you use this socio-ecological model to make sure that you take into account of all those factors that can affect someone's ability to take up the health behavior that uh, you're putting across for them to take up. So the advantages of this socio-ecological model is that it provides a comprehensive and holistic approach to understand health behaviors and the social and environmental factors that influence them. And it can be useful in identifying multiple points of intervention for behavior change, because it really focuses on everything that can influence behavior. Of course, like any other model, it has been criticized because it may require a lot more work to apply in practice, because it is very comprehensive, so it requires more work to apply. So it requires more work because it requires consideration of multiple levels of influence and may require collaboration across multiple sectors. But if you're to look at it keenly, because it involves collaboration with multiple sectors, it rhymes well with principles of health promotion. So it is always very, very applicable and useful to use in your interventions of health promotion. So its application is that it's applied in a variety of health behaviors and public health issues such as obesity, tobacco use, and health disparities. Yeah, and since one of the major issues that we 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 aim at promoting is health equity in health promotion. That means that this model, the socio-ecological model, is very, very important in our health promotion activities. Then the last model that we are going to focus on today is the operant behavior model, which was put across by uh, a renowned psychologist called B.F. Skinner. And Skinner said that the operant behavior refers to behaviors that are influenced by their consequences, and behaviors that are rewarded are more likely to be repeated by the people who perform them. But the behaviors that are punished or not reinforced are less likely to occur again. So, when applying this operant behavior, we have to appreciate some of the concepts that were put across by this renowned psychologist Skinner, and one of them being positive reinforcement, which includes rewarding desired health behaviors to encourage their repetition. And an example here we can look at providing incentives for individuals who consistently engage in physical activity. So if you are in a workplace and you have put in place a health promotion program of increasing physical activity, so those individuals who consistently engage in that program of physical activity can always be given that incentive or a reward. And then if they are always given that incentive, it could be in form of money, it could be in form of gifts, and this will encourage them to repeat the same and and uh, and maintain such a behavior that gives them a reward or incentive. Then in negative reinforcement, we remove or avoid a negative consequence to promote health behavior. So in this case, you're not going to put a punishment like we are going to see in the next slide, but you're going to remove that adverse or that punishment, and in so doing, you're promoting this health behavior. So, for example, if you remove a mandatory fitness class for employees who consistently maintain a healthy lifestyle, then they are going to continue to maintain that healthy lifestyle. Because you can imagine if you have been making sure that people in a workplace where you're working as a health promoter engage in mandatory fitness class, but there are some people now who have maintained a healthy lifestyle of not eating junk, of exercising, So if you remove that mandatory fitness class for such employees, then you're going to promote the maintenance of that health lifestyle. Then another concept of operant behavior is punishment, where you discourage unhealthy behaviors by implementing negative consequences. For example, imposing fines for people who smoke in public to deter other individuals from smoking in public, and even stopping smoking altogether. Then the last concept in this operant behavior is what we call extinction, where you remove an enforcement, a reinforcement for undesired behavior to decrease its occurrence. And an example here is ignoring or not rewarding a negative behavior so as to discourage its continuation. Yeah. So if you have been serving maybe junk food at your workplace, if you stop this junk food at your workplace, then you're going to encourage people to to be eating food which is healthy, and this is what we call extinction, in which is a very good construct in operant behavior as proposed by B.F. Skinner. So the benefits of this operant behavior in health promotion is that it increased motivation and engagement in health behaviors. So if health behavior involves motivation and engagement, then it is more likely to be sustainable. Then enhanced likelihood of behavior change and habit formation, because uh, the behaviors of these individuals and communities are related to them receiving rewards or incentives, so they will be motivated to change their behavior to the one which is desirable. Then improved overall health and well-being of individuals, because of those incentives or motivations that you have put in place. So if you put them in place, they will struggle to get them, and we without realizing it will become a habit, and they will maintain such behavior and promote the same to the people who are around them. So as we implement this operant behavior model, we must be considerate, and we must take into account of these ethical concerns. So you ensure that you use positive reinforcement and rewards rather than punishment whenever possible. Yeah, always focus on using these positive reinforcements instead of using punishments, and do not force someone to take up what you need. So you respect their autonomy and freedom of choice. Give them the information that is relevant to changing their behavior, but do not force them. And then avoid stigmatization or discrimination in health promotion strategies. So do not stigmatize someone uh, 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 as if you're trying to punish them, but you're ending up stigmatizing them to take up your desired health behavior. So you avoid that and make sure that there is no discrimination in health promotion strategies. So that brings us to an end, and in all this, in conclusion of all this, we realize that determining which model or theory to use will depend on the situation that is at hand. So in many cases, as health promoters, we find that using more than one model is appropriate, or that only certain aspects of a model are useful. For example, if you're working with an obese individual whose family members eat whatever they want without developing diabetes, then the health belief model will be important in your case, because you will need to enhance the interventions for perceived susceptibility. Those people, that individual will need to know that they are susceptible to developing diabetes due to their obesity. So you need to use such a model, which is the health belief model, in that case. On the other hand, if you are working with a group of low-income people dealing who are having obesity and are working for the same employer, then the social ecological model will be very useful in your case, because you will need to put more effort into creating and supporting healthy work environments, and finding opportunities and resources for exercise and healthy food options for such people. But as you can realize, in both situations, you will need the trans theory model, which we call the stages of change model, that will help you to determine the appropriate intervention that will move those two groups of people from where they are towards behavior change. So you can realize that you do not have to use only one model when you're implementing your health promotion activities, but you can use more than one model and some aspects of a model without using all of it. So you just have to be flexible in applying these theories and models. Thank you so much for your time, and I'll catch you on the next one. Bye.